We talked about the example of Ireland. Now, could you give us examples of how to build a system of healthcare, a healthcare system for haemophilia in emerging countries, in developing countries?
Well, I think over the past 10 years, when I started with the Federation, we started doing a lot of work in developing and emerging countries, from training of doctors and healthcare workers at expert training centres, to twinning programs between haemophilia centres and haemophilia organisations in developing and developed countries, to specific country programs where we would look at one or two elements of care. And it became apparent over the years from our experience and from the outcome of these programs that for improvements to be sustainable, you needed a coordinated, holistic approach where all of these elements were brought together. So if you look at a country, a developing country, and you want that country to have better haemophilia care, improved haemophilia care, which is sustainable and which will last after you leave the country, then you need to work on several elements. You need to look at the medical personnel available and their training. You need to look at the laboratory personnel and their diagnostic capability. You need to look at the medical infrastructure and the organisation of haemophilia services within the healthcare system. You need to look at the patient organisation. You need to look at the replacement therapy available for treatment. And crucially, you need to look at the government commitment, because even if all of those elements are not in place, the government holds the budget. You cannot have good haemophilia care if you don't have the budget. And so you must get the government to commit to that programme. I've seen countries where there are excellent doctors, where there's a very strong haemophilia society, but they can't do very much because the government is not interested in haemophilia care. So what we try and do is get the government to commit to a programme. We will look at those 5 elements. We'll talk to the government in the country, and we will say to them, look, we will sign a contract with you, and we go as far as to sign formal contracts with governments over a 3 or 4 year period where we commit to providing training and assistance with laboratory diagnostic capability, and we'll source some donations of medication, and we'll help to train their patients and educate the families. In return, the government puts in place a national haemophilia care budget. They'll work with us over those 3 or 4 years, and so you start to see a national programme developing within the healthcare system. Now, the idea is that after the 4 years, when we finish work in that country, and we taper that off over the next year or two, that the government's commitment continues to increase on an incremental basis. And I think that's how you build sustainable care. There was no point in having a 2 or 3 year programme which works well when you're there and disappears as soon as you've left the country. Now, we started this programme in 2003 with the idea, it's called the GAP programme, Global Alliance for Progress. And the idea is to look at diagnosing and treating up to 50,000 new patients with haemophilia in up to 30 countries in 10 years. And already I think the programme has started in 13 countries, and government agreements have been signed with the governments in Georgia, Armenia, Azerbaijan, Egypt, Jordan, Ecuador, Thailand and Mexico. In those countries in the last couple of years, formal agreements are now in place with the governments where they're working with the World Federation of Haemophilia to implement national haemophilia programmes within the healthcare system. And that's sustainability. And we've seen in the countries where the programme is now finished, like Georgia, that it's continuing. And in some of the countries like Armenia, they have already exceeded, the governments have already exceeded the commitments they made for the end of the programme when they're only halfway through the programme. So this is working. This is an approach which is working.